Laser Core of Knowledge. Module 2, Risk Assessments, Hazards and Safety. Laser Core of Knowledge Module 2 focuses on one of the most important areas of laser and IPL practice: risk assessment, hazards and safety. Working with laser and optical radiation equipment carries responsibility. These technologies are very effective when used correctly, but the consequences can be serious for both patients and staff when controls fail. Starting with risk assessments. A risk assessment is a legal requirement with an emphasis on safety. It identifies potential hazards and ensures the correct precautions are in place. The Health and Safety Executive has a 5-step process. First, identify hazards. Second, determine who might be harmed and how. Third, evaluate the risks and decide on control measures. Fourth, record your findings and implement them. And finally, review and revise regularly, especially after significant changes. Risk assessments should consider 4 key areas: equipment, personnel, procedures, and location. This includes all staff, not only the authorized users, but also cleaners, contractors, visitors, and patients, particularly vulnerable individuals. Laser hazards fall into several categories. Optical radiation can cause eye and skin injuries. Direct exposure, focused beams, and reflections, both specular from smooth surfaces and diffuse from rough surfaces, can present risks. Metal tools and even jewelry can unexpectedly reflect beams. This is why operators must wear the appropriate protective eyewear and remove reflective items from the workspace. One of the most common tissue effects is thermal damage. Excessive heat can cause burns, blistering, or tissue vaporization. Photochemical effects from ultraviolet or blue light can damage the cornea, lens, or retina. Short pulses may also cause photomechanical damage through shock waves within tissue. With high-powered systems, electrical hazards are another concern. Faulty wiring, improper grounding, or exposed components can lead to shocks, burns, or even fire. Proper staff training, regular servicing, and working to manufacturer guidelines are essential to minimize the risk of accidents in your practice. All staff must be aware of the fire risk when using lasers. Class 4 lasers in particular pose significant fire hazards. Flammable materials, surgical drapes, hair, solvents, and even hot fiber tips can ignite. Take preventative measures such as adding fire-resistant barriers, safe handling of fibers, keep saline nearby, and follow strict activation protocols. Laser plume emissions, also known as smoke plumes, contain bioaerosols, gases, and potentially infectious particles. In some instances, standard masks are insufficient and smoke evacuators must be used. They should be positioned close to the treatment site so they effectively capture any contaminants. To maintain safe exposure levels, practitioners must understand maximum permissible exposure, or MPE. Exposure must always be kept below the established limits through engineering controls, procedural controls, and by wearing the correct PPE. Only fully trained personnel can carry out beam alignment. They must use minimal power settings, wear appropriate eyewear, and observe strict environmental controls. As in all workplaces in the UK, incident reporting is compulsory. Any adverse event must be documented and reported according to your organisation's procedures. This includes notifying the relevant authorities if required. Safety is continuous, proactive, and shared responsibility, not an optional extra. By having structured risk assessments, maintaining equipment integrity, and working to establish safety protocols, we can help protect our patients, our colleagues, and ourselves. Always assess. Always control. Always prioritise safety.